Is migraine medication safe for pregnant women? Imagine dealing with a migraine while expecting a little one on the way. It's a tough spot, and many wonder if their usual migraine medicines are safe during pregnancy. Let's explore what the facts say about this important question. For pregnant women, the safety of migraine medications depends on the specific drug and the stage of pregnancy. The safest first choice is usually acetaminophen, also called paracetamol. It is generally considered safe throughout all 3 trimesters when used at the recommended dose. But it's important not to take more than 4 grams in a day to avoid liver problems. Non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen and naproxen, can be used carefully during the 2nd trimester. They are usually avoided in the 1st and 3rd trimesters. In the 3rd trimester, NSAIDs might cause issues like premature closure of a blood vessel called the ductus arteriosus in the fetus. They can also increase bleeding risks during delivery. Triptans, which are drugs that narrow blood vessels to relieving migraines, have mixed safety data. The most studied triptan is sumatriptan. It appears to be relatively safe and does not seem to cause birth defects. But some studies have shown potential risks like higher chances of miscarriage or bleeding after birth. Because of this, healthcare providers usually recommend triptans only if the benefits outweigh the risks and after careful medical advice. Other migraine medicines, such as ergots, lasmiditan, and newer drugs called gepants, are generally avoided during pregnancy. There isn't enough safety data on these drugs, and some could pose risks to the developing baby. When managing migraines during pregnancy, doctors often suggest non-drug approaches first. Rest, hydration, and avoiding triggers can help. If migraines are very severe and don't respond to safer options, a healthcare provider might consider using triptans or other treatments with caution. The goal is to balance the health of the mother with the safety of the baby. It's important to remember that untreated severe migraines can cause stress and high blood pressure, which are not good for either mother or baby. So, working closely with a healthcare provider to find the safest and most effective treatment plan is key. Always consult your doctor before starting or stopping any medication during pregnancy.